Hi, it's Dr. Karen Smith with ultrasound in the direct method for wound care. So far, the dressing to this wound has been removed. The wound has been irrigated with saline. We have applied a clear hydrogel inside the wound. We did not apply ultrasound gel inside the wound. We did not apply Silvasorb with silver inside the wound. If we were using this as a wound dressing, we would have irrigated it out with a wound cleanser first. After the hydrogel was placed in the wound, then we have this thin film material that you may use. You may see it as opsite, tegaderm. This is a wound vac material here that I have the thin film on, basically sticky cellophane, and so I'm just removing the outer layer there, and so what is left is the gel inside there touching the wound, and then this plastic layer that will keep the ultrasound unit from actually touching inside the wound. Now here's the trick. We can put our ultrasound gel on that clear film. You can kind of see that now. We'll come over to our unit because now we're ultrasounding through an area with knout skin, and we have 3.3. Some units will say 3. Chattanooga's is 3.3 for their ultrasound. If you're just going superficial on the ultrasound around the wound in the separate video, you can also use 3.3. Sometimes you can, if the skin is totally intact, you may be looking for the deeper. That's the difference. That this 3.3 is a more shallow, superficial depth, but in this instance, the particular area we're going over has no skin, so the impedance is greatly reduced due to that. And our 20% duty cycle, and so you can figure out your ERA for the size of the wound. And then we're gonna take our ultrasound head, place it right on over the wound on that cellophane clear film, and then we'll hit the start button to the ultrasound machine and turn our intensity up to 0.5 to 1, and we will simply do this for our 5 minutes, 7 minutes, however long your treatment session is. Can you go outside the wound to the edges of the wound? Certainly. That is an acceptable treatment also. Okay. Slow circles. You don't have to press down hard. The energy is moving through the thin film and through the hydrogel on the wound side. After your timer is up, ding, you may lift the sound head, and then at this point you'll be removing the thin film that you have placed on there. And to remove a thin film, then you can do a lateral traction that makes it release some. You can do a move where you push down on the skin and pull up on the dressing. So once the dressing is removed, then you have sterile hydrogel in the wound, and you can irrigate that out if you don't want it in there, or you can use your sterile gauze to help cleanse the area. It depends on the patient's pain control at that point. You can cleanse the area and then dress the wound with whatever dressing is on the patient's wound care protocol. This treatment is performed once daily. Typically, it depends on the size of the wound, for 5 to 7, maybe 10 minutes for larger wounds. And then you can document before and after the wound, to make sure that you look at the wound periphery and how that goes and how well the patient tolerated it. Patients, this is a sacral ulcer, and they will typically be laying on their side for that, so positioning would be very important for this patient. Thank you.